Hi everyone. Welcome to Alive with Dr. Vishali. Today is World AIDS Day, and it's very important to understand why there are, the cases, what happens in AIDS, and how you can protect yourself. As the times are changing, a lot of people are following casual sex, and a lot of time millennials and Gen Zs are not really informed about the safe sex practices. And not just today, we keep on talking about sexual wellness on our website, on our Instagram channel, on our Facebook pages. And today is a time where we should openly talk about this issue, and we should, remove any stigma behind HIV testing or AIDS and understand what exactly happens. So today we have Dr. Vishali Sharma, and she's a national award winning laparoscopic surgeon and IVF specialist. Recently, she's been conferred a certificate of achievement from prestigious Harvard Medical School, and she's here to tell you more about your sexual wellness. If you have any questions, any doubts, please go ahead and ask those questions in the comment section, and share this live session with all. If you're older, then share it with your younger friends, relatives, so that they get informed. And I will now hand over this live session to Dr. Vishali. Will present, and she will take over now.
Thanks, Palak. Thanks for such an elaborate introduction. And it is really very nice of you to select this topic. It is actually the need of the hour as the times are changing, the uh, mm, people are changing, our kids, our youngsters, the accessibility that they have, the environment that they are living in, their choices, and the whole everything, the whole environment around them is changing. And I think we are responsible on our part that we should make them aware that yeah, they have the freedom, they have their freedom of choice, they have their freedom of their opinion, but they should be aware about the complications associated with it, what are the problems which they may face later on. Because many a times I get young girls or young couples who many times they tell me कि nobody told this thing before to me, I was not aware that this can happen or this thing can be transmitted by like this. So there are really, in spite of so much availability on the Google or online platforms, even then our youngsters are not that much aware about the risks involved and the complications they may have in case they are not really aware and they are not taking an informed decision. So let us start one by one talking about various infections or the various complications, and why is it important to have safe sex and what is actually a safe sex. So we will be discussing all these things one by one, and it is in particular to the millennials and our Gen Z daters, because nowadays it has become really very common and it has become very easily available on various apps. And it is also, it's okay, it's good that they have so many options to choose someone for their as their life partners. They have the freedom to first assess them, they try to understand each other. So all these things are good, but they should be actually aware about the sexual wellness, which is actually very important as you proceed further in any relationship. So let us proceed. We can start our slide, these things. So most important thing they should be aware about, there is a difference in STI and STDs. Whenever somebody has something, they just come and they ask me कि ma'am check me for STD. I had an unprotected intercourse last yesterday or something. Many couples they come to me, or many girls they come nowadays very easily, very they want themselves to be checked for these things. So what do we need to know is there is actually a difference in STI and STD. We call it STI when the pathogen, it can be a bacteria or a virus or a fungus, it is there, it is transmitted to your body through a sexual contact. But there is no clear cut symptom or any sign. You don't have any disease per se right now. But you should be aware that there are certain infections which can be transmitted sexually, and those are called as STIs. When in certain cases where you actually have some symptom, like in case of females, they may have vaginal discharge or itching or any lesion in the vulva, like an ulcer or any node or nodule or any papule over there. All these things can be sign of sexually transmitted disease. So this is the basic difference. So don't wait for the symptoms to come. Always get yourselves checked for any sexually transmitted infection if you are active. So, if we come to the next slide, we can see what are the signs and symptoms of STDs. So, as we were talking about, there can be some lesions in the vulva in case of females, or even in the case of males also, there can be some lesions in the genital area. There can be a painful ulcer, there can be a painless ulcer also, there can be warts, and similarly, there can be a papule. So there are so many infections are there which can be transmitted, and every infection presents it in a different way. But if you ever feel you have any lesion which is abnormal, which was not there earlier, then you should be aware about it, and you should definitely consult any gynec nearby you, so that if it is there, it can be detected at the earliest. Similarly, if you have vaginal discharge, sorry, please go to the back slide. Yeah. Similarly, if you have a vaginal discharge, there are many types of discharges. It can be white in color, it can be yellowish green in color. So it depends upon what kind of infection is that, because we give antibiotics according to that only. So if you are coming to us with a specific kind of a discharge, then we will be able to tell you, okay, you have this infection and it needs to be treated. So anyway, whatever kind of abnormal discharge you are facing, then definitely you need to visit a nearby gynae. Similarly, if you are having some fever or lower pain in the abdomen or backache, or if you are having pain during intercourse, in fact, then it is also a sign of some kind of infection in the your genital area or the pelvic organs. That is called as pelvic inflammatory disease. It is in short we call it PID. So all these are the signs and symptoms which can be there if there is an infection. Similarly, if you are getting intimate with your partner and you notice some abnormal lesion there, you notice a ulcer or a nodule or a papule, whatever, any lesion there, you find a rash over there. So try to avoid intercourse in such a condition. It can be a sign of STD. Similarly, if any discharge is coming out of instead with the urine or from the urethra, that is the opening of the urine pipe. So any discharge if it is there, any blister if it is there, so all those things are sign of any STD. So it is always better to get it checked, get it treated, and then you can proceed further. Better to avoid intercourse in that condition. So if we move to the another slide, uh, let me see. Yeah, the next slide. Palak, can you change it? Yeah. So these are the most common STDs which are actually very commonly known to whenever anybody encounters any unprotected exposure, they usually come to me and ask me to please check me for HIV or check me for HPV. But there are some others also which can be transmitted through sexual intercourse, and these are also can be very troublesome for you. Many of them they persist for lifetime also. So HIV, HPV is very commonly known. Everybody knows about them. Today it is World AIDS Day. So HIV is different from AIDS in a way that HIV is just an infection. And when a person who has an HIV infection, because once it is there, it usually persists. And if it is there for a longer time and the person has not taken any treatment for that, in that condition, the patient can have started having symptoms, and those symptoms in the very later stage are called as AIDS. So HIV is just an infection, but yeah, it can be transmitted if somebody is HIV positive, and you should be very cautious and you should be aware about it. Try to avoid encounters with unknown people. Similarly, HPV is also a virus which can be transmitted sexually, and the thing is that majority of the male counterparts they usually don't have any symptoms. because there is no usually there is no discharge, no lesion as such. They may not be having any symptom per se, so it is very difficult for them to know that they have any STD as such. But yeah, in females the symptoms they come very quickly. Whenever you will have any infection, the symptoms will appear very quickly, and that is why always females they usually come with the symptoms and we diagnose something, then we check for the partner, and then we find out कि, okay, he was a carrier. So this is the reason that why it is so common in females, and they should be more cautious. That is the reason why, because male partner they may not be even knowing that they are having any kind of infection. So these are the most common STDs that mostly the people they know about. But if we talk about other common STDs, which are actually more commoner than these, but they are not that commonly known. So if we move to the next slide, uh, we can see a whole list of organisms and the infections, which are, though these are less commonly known, but these are more commonly found. When we do a testing, there nowadays we have so many ways of testing for these bacteria or fungus or virus. When we do a testing, we check for all of these. Where there is a test called STD PCR 9, where we are testing for all the 9 kind of bacteria, virus, and fungi, and we are checking just with a small swab that we just take from the vagina, a small cotton we take to wipe the secretions which are present in the vagina, and we send it to the lab for checking that. So this way we are able to find out which bacteria or which infection is there. So it is a very easily available test, which is you can get it done anytime whenever you want to visit. It hardly takes 1 minute to do it, and it is completely painless, and it gives you information about all these bacteria which can be there, and you may not be aware that yeah it is actually there. So if we talk about these chlamydia, gonorrhea, these usually they don't cause symptoms many a times, and the female may be having these infections. The worst part is that they are not causing any problem right now, but later on, when they get married, they want to try for a pregnancy. In that condition, these bacteria they cause certain damage to the genital organs, the uterus, and the tubes. So it hampers with the fertility. When you try to conceive for a baby, then there are chances that you may not be able to conceive if there is damage done to the tubes by these bacteria. Or if you are trying for a pregnancy and there is only little damages there, the tube is not completely blocked. In that situation, there are higher chances of ectopic pregnancy. Ectopic pregnancy is a very deadly condition where pregnancy happens, but it stays in the tube because of the infected portion, and gets stuck there. It is not able to go up to the uterus, and then it grows inside the tube. Then it can gradually rupture because there is no space in the tube to grow further. So these are the complications which can happen later on when you will be married. You will be trying for a pregnancy, and actually you could have gotten it treated many years back when there was ideally actually there was no symptom. But if you would have gotten a routine gynec checkup and a routine STD panel checkup done, so that if it was found there, we could have treated it very easily using antibiotics for 7 or 9 days, and it usually goes by these antibiotics. So this way, the if the this is small information that if you are aware that you have to get a routine annual checkup if you are sexually active, then in that situation always get your STD panel done once a year. It has been recommended specifically for females who are more than 25 years of age. So in women who are more than 25, we usually recommend to get STD panel done once a year if they are sexually active. So in that condition, we check for all these. They have different signs and symptoms, and they have the treatment is easily available for all of these, mostly all of these. So if we move to another slide, let us talk about the women who are at higher risk of having chlamydia and gonococcal infections. So there is a whole list. If they have a very new partner, recently there's a change in a partner, they have more than one partner, or in case your partner is having concurrent partners. In such cases, you become at higher risk for these infections. It may not cause any symptom right now, but it can predispose you for some problem, infertility or ectopic pregnancy, or many such problems later on in life. So, if you are more than 25 years of age, it is always a good idea to get yourself checked or screened for STIs annually once in a year if you are sexually active. And if you are having this profile, or your partner was recently changed, or you are having more than one partner, then in that condition it becomes really very important. Similarly, if your partner has some STI, or if you don't use condoms so frequently, and specifically if you are not in a mutually monogamous relationship, then definitely there is a very high risk of having these infections, these bacteria. These are very commonly prevalent in our society. So you should be very aware, you should be actually very cautious that you need to get yourself checked and get it treated before it leaves any damage to your tubes and uterus and your body parts. So if we move to another slide, next slide please. Yeah. So similarly, bacterial vaginosis is also vaginal this STD basically. In this, patient has a grayish kind of a discharge, and it has a specific fishy odor. So it also is very troublesome for the patient. It is very irritating discharge. So these things, the female becomes a high risk for bacterial vaginosis when she has multiple male sex partners, or if she has a female partner, or in cases of sexual relationships with more than one person. Again, if there's a recent change in the partner, or if you don't use condoms, and also if you are already carrying herpes simplex. Herpes simplex is again a virus which, once you are infected, you have that virus. You may not be having any symptom, but the virus stays there. So, if you are positive for this virus, then you are again at a high risk of bacterial vaginosis. So, the most important thing is again get yourself checked with the STD panel, wherein we are checking all nine major organisms responsible for STDs. So these can it can be done very easily, and once it is known that you have this bacteria or this virus, the treatment is also easily possible. So the most important thing is we should not miss the important time, the actual time where we can treat the disease. If we are able to do that, we can avoid the complications which can occur later on in your life. Again, in one study, it was found that the male circumcision, it reduces the risk of bacterial vaginosis among women. Later on, I'll be discussing male circumcision has been found to be really very helpful in prevention and reducing the chances of transmission of STIs both in males and females. Specifically for the females, also, it reduces the transmission of HIV, it reduces the transmission of bacterial vaginosis, it also reduces the transmission of human papillomavirus, that is HPV. So, in that way, it is good for the males as well as for the females. So, male circumcision has been proven to be really good in prevention of STIs. So, if a person who is actually very active in dating and having a casual sex kind of a thing, then this circumcision can prove to be a boon for such a person and also for his partners. So, if we talk about further other diseases and the other bacteria of the genital region, so let us move to the next slide. Yeah, Palak, can you please change it? Yeah. So similarly, when we were talking about the high risk factors for bacterial vaginosis and chlamydia, for genital herpes also, in case a person has more than 10 lifetime sex partners, then in such cases, the person becomes really high risk for genital herpes, and we should do annual checkup for genital herpes for such person. And in cases the person is having HIV infection, then definitely we need to check the person for genital herpes. It is again a virus, and it causes small painful ulcers in the genital region. The ulcers are so painful that it is really difficult for the person to sit, to walk, to move, to pass the urine. It is really very painful. So this infection is preventable if you are cautious, and also you should be aware that once the herpes is there, it will stay in your body. It is not going to go. Then you will have to build up your immunity to so that you don't get symptoms. As such, the virus is not causing any problem to you. But when there are ulcers which may develop because of the virus, then in that condition, that is actually very horrible. It is a terrible pain. I get so many patients with this kind of herpes. The females, I think every week I get one patient in that way, and it is actually very painful condition. It's not so simple, and once the ulcer develops, it takes time also to heal. It doesn't respond too well to the antivirus. We have to wait for at least a week before the some relief is there. So the best thing is to avoid its prevention. Always, in case there is a new partner or you are moving ahead with a new relationship, it is always better to get yourself checked with these viral infections, because once infected, then we will not have any prevention for you. In that case, we can just find the solution and treat your symptoms. So herpes is one thing which is not life threatening. It is not too it's not going to affect your life too much. But once the ulcers are there, whenever they are there, it is going to be very troublesome for you, and then it will take a week for you to come back to your normal routine. So that is the reason why herpes is so important, and you should be aware about it, because it can also be transmitted sexually. If we move to another slide, now let us talk about STIs which can be prevented by vaccine. It is a good thing that nowadays we have a vaccine for HPV, because this human papilloma virus, it is responsible not only for warts or sexually transmitted disease. It is also responsible for a cancer which can develop later on in the life. Both in case of males and in females, if HPV is persisting for many years, like 10 years or more than that, in such a condition, the person can develop cancer of vagina or vulva or cervix. And similarly, in case of males, genital organ cancer is there due to this virus. But nowadays, we have vaccine for this, and it is easily preventable nowadays. It has been recommended for both males and females age around 11 or 12, and it can be administered even at early as an age of 9 years. And though it was advised to be administered till the age of 26, but even then, those who have not had this vaccine earlier because it was not available or the guidelines were not there, even they can also opt for this vaccine even if their age is more than 26. There's no harm in having it. Only thing is that if you are already infected with HPV, then it is not going to help you. But in case there is no HPV yet and your age is even more than 26, in that case, it is really going to help you because it prevents infection with HPV, even if your partner is having this infection. So, this is a very good vaccine, and usually 3 doses of HPV vaccine are advised on 0, 1, and 6 interval. Similarly, we have vaccines for hepatitis A and hepatitis B. So, hepatitis B vaccination is also really good because otherwise it is a very deadly disease. It leads to inflammation of the liver, then gradually failure of the liver. So all these things can be avoided just by vaccination, and it is specifically recommended for all the persons who are sexually active with more than one partner and are being evaluated or treated for an STI. Again, 3 doses are advisable for it: 0 dose, and then the second dose after 1 month, and the third dose after 6 months. So this way we have vaccines for some STIs. If you are aware about it, you can definitely get it and you can prevent yourself from these infections, even if the person who is your partner is infected with these. So if we move to the next slide, let us see. Palak, can you please change it? It's not changing. Uh, Palak, I am unable to change the slide from my end. Can you change it? I think there is some technical glitch. No problem. Let us go ahead with the slides. So we have already talked about vaccines, which can help us in preventing the STDs. So, what are other ways how can we prevent STDs? The another is obviously majority of us are aware about this condoms that these can prevent transmission of STDs. But you should be aware that the condoms which are being used by males are easily available. There are some condoms which are used by females. Those are also available. Those are called as internal condoms, and you can get them also. Similarly, there is another thing called diaphragm. It is also used as a contraceptive, but again, it is also very beneficial in prevention of sexually transmitted diseases. If your partner is not using condoms or is not comfortable in using condoms, then you have the option of using these, because you can these can be used from your end. You will have the your freedom to use them, and in that way you can prevent any infection coming to you. Similarly, if we talk about any other way, then other contraceptives they don't offer any way of preventing STIs. So, if we talk about per se prevention of sexually transmitted infections, then condoms are the best. But if we talk about contraception, that is the prevention of unwanted pregnancy, then condoms have a slightly higher failure rate. So in that case, what you can do, you can combine two things. Always use condoms if you are having any new partner or you are not in a completely monogamous relationship. Then in that case, always use condoms. And for contraception, you can use maybe like oral contraceptive pills, because they have a higher success rate as far as unwanted pregnancy is concerned. So similarly, if we talk about further, what is the best way to prevent STI? I would say participating in a long-term mutually monogamous relationship with a partner is the best way to prevent any kind of STI. So it is a good thing that you have the option of dating. You can go and check about the nature and your compatibility. That is a really good part. But it is always better to move ahead if, only once you are settled that yeah you are in a mutually decided monogamous relationship. And I just wanted to bring this thing also in your notice that there are certain premarital blood tests also that which we are advising nowadays whenever you are deciding to move ahead. And these blood tests again tell us about some kind of infections like HIV, hepatitis B, hepatitis C, and syphilis and herpes. These infections should always be checked before you are moving ahead, because yeah, if these are there, then they will definitely be transmitted to you. And again, the treatment may or may not be there, but yeah, if prevention is we know always better than the cure. And the next thing is always get your blood test done, and we can check them with a swab, which short. So that's it. And I think we are running out of time. So I think I was able to cover all the aspects that we could as far as all the things related to STIs and STDs were concerned. And if there are any questions, we can definitely talk about them. Yeah, I had this thing also. What to do once there is an episode of condomless sex? Then definitely there are certain things you should definitely do. One is emergency contraception to avoid unwanted pregnancy, and another is to have a course of antibiotic to avoid any kind of STI, which is most commonly spread, like chlamydia and gonorrhea. For that, you can visit your nearby gynec also, and you can, but don't miss the timeline that all this things should be done within 72 hours of the unprotected sex. So always take care, be careful, and let us hope that I am able to sort out some queries and I am able to generate some awareness about the complications which are associated with the current environment that we have nowadays. So,
Thank
Palak,
you.
yeah, we can
Thank you
take.
so much, Dr. Vishali. It was a really informative session, and I gained a lot of information. I hope it was useful for our audience as well. Thank you for your time.
Okay, thank you, Palak, for organizing such a informative topic and choosing it for our millennial and Gen Z generation. Thank you. Thanks a lot for
Thank
having
you.
me.
Thank you. Bye.
Bye.